I would have to say without a doubt that plastic surgery has always been my destiny. Medicine as well was always in my future, and when I started studying medicine, I was thrilled by the idea of curing disease and assisting patients. But I found the science of medicine, though thrilling, left me with a tremendous void in its lack of creative and artistic expression. Plastic surgery became an obvious choice to me when, after a few years of general surgical registrarship, I found myself being drawn more and more to the reconstructive side of things, the architectural side of things, the artistic side of things. And once I'd completed my residency, I was tremendously fortunate to be awarded a fellowship in Paris, where I studied with the legendary Professor Daniel Mashak. New aspects of plastic surgery started opening up to me. I'm confronted every day by patients who sit in front of me saying, "I despair when I turn the bathroom light on in the morning and see my reflection in the mirror." People, I won't say women only, women and men out in the general community are hiding.
I remember on my 21st birthday, wear a tank top standing in front of the mirror, and I felt very confident. I've always had large breasts, and but I remember from 21 to 25, that weight in the breasts have sagged out. And from there on, I wanted to hide them. And I'd never felt comfortable. I can't wear what the other people were wearing. Life happens, and as a mother, sometimes we don't really do things for ourselves. And I had a conscious decision where I said, I would like to, if there's anything I would like to change, is the gravity that happened. Before the surgery, it was hard to do fun activities with the family because I had either lower back pains, or if I have to be in a swimsuit or have anything on that's revealing, I feel uncomfortable. So I withdrew from activities.
Prudent plastic and reconstructive surgery, in its essence, is all about freedom. It's about freeing patients from bondages. The obvious one, of course, is freedom from disease. Breast cancer is treated, the patient is reconstructed, they have freedom from the life-threatening illness. Walking this path with me, I see how this patient's mindset changes. I watch her move from a stoic survivor mindset to an overcomer, to someone who triumphs over her illness and is reconstructed to a level where she is more body harmonious than she was even before she had her diagnosis. So she doesn't just survive an illness, she gives it a kick in her way past and steps over it to her better life that waits ahead for her.
The idea of being told you've got breast cancer, just even the thought of it rather than the reality, is a daunting one. So when it becomes a reality and you're told it's here, you're dealing with it, it's really frightening, because your breasts are part of how you identify as a woman, just not just physically, but as part of your sexuality as well. The journey of having the mastectomy and reconstruction is traumatic, but you need someone who understands and who is invested in making sure that when the journey is ended, you can stand in front of a mirror and feel whole again. And that's something that we went through, that Jonathan has helped me be able to do. He's still making sure I'm happy, I'm comfortable with who I am, and that I can stand in front of my husband and feel proud of how I look, and that I can feel confident and go out in public. So having the right people around you, choosing the right people to take you through that journey is vital.
My approach to aesthetic surgery is that it should never wave a flag. It should never be identifiable or clearly evident to a lay eye. It's not going to turn you into something you were never supposed to be. The caricature-like over-plumped lips, over-elevated brows, over-filled cheeks, these are things I despise, because a child can identify that work has been done, and that to me in its essence is a failure. Aesthetic surgery is not supposed to announce itself. It's supposed to let you be graciously and gracefully your best you.
This whole experience has changed my life, because on the age of 40, standing in front of a mirror, I feel like that 21-year-old. I am having social activities with my family now. In a nutshell, this has given me freedom.
Patients are in fact taking the bold step of revealing to me someone they don't yet know, that which makes them feel least beautiful, least worthy. I never take that lightly. It's a tremendous privilege and a responsibility. When a patient comes to you and says, "This is what I hate most about myself, can you help me?" and present it to you. And watching that person shed the fetters of what's been holding them back, to emerge feeling that they're the best version of themselves, what could be more rewarding than that? I've often used the analogy that in the Renaissance era, the Michelangelos and Leonardos would paint something beautiful or sculpt something beautiful out of a piece of marble, and their communities, their contemporaries would stand back and cheer and observe and admire. That must have been tremendously rewarding. In my career as a plastic surgeon, I have a greater privilege than they, because my sculpture or my painting gets down off its plinth, off its easel, comes over and gives me a hug and says to me, "Dr. Toogood, you don't know quite how deeply you've changed my life." What could be more rewarding than that?